Hi everyone, this is Paige Leslie from Lancaster School District, and today we are talking about our distance learning fluency program. So this video is aimed for parents. Your children can watch too, that's no problem, but it might be a little bit boring. So I'm going to share my screen. Again, I'm notorious for taking a long time. There we go. We're starting to get the hang of this thing. So this is kind of what to expect from this distance learning fluency program. What are some of the things that you're going to see on the channel? And what do I expect from you guys during your check-ins if your student is working on fluency? So we have a whole bunch of strategies here that we're going to be addressing. So the first one here is called Fluency Shaping. So these are strategies that are going to make it more likely that your student is going to have smooth speech. So a lot of what we do in preschool especially is looking for, is the student using their strategies? So our goal isn't necessarily that they'll be 100% fluent while they learn these strategies. It's just giving them different ways of speaking and looking at speech that will make them more likely to be smooth, right? And since we're working with preschoolers this year, you're going to see me using a lot of metaphors and not a whole lot of technical terms, right? So you'll see my little turtle friend here a lot because we talked about how turtles move and how we should copy turtles and how they speak to give ourselves very, very smooth speech. So let's see. Here we go. I want to share that. I want to share my PowerPoint again. There we go. And then we're also talking about awareness and relaxation. So let's see. So we're going to be talking about an awareness of our speech, awareness of our speech mechanism or our speech machine. So talking about the different body parts that are involved in speaking and how they work. So this is kind of the counseling part of fluency therapy, which I feel like every type of speech therapy has a little bit of a counseling component, but especially fluency. And then we're also talking about relaxation. Now I want to make it clear that fluency disorders and stuttering is not caused by anxiety as a personality characteristic. The presence of stuttering does not mean that your child is nervous or is like an anxious person, or that they're more anxious right now, like something in the environment is making them anxious. That's not the case. However, as students become more aware that they are stuttering and they become more aware of society's kind of expectations of speaking and that they're different from people and that is looked at as negative sometimes, and hopefully we're moving towards a world where we don't assign negative personality characteristics to people who speak differently. But as they kind of get that awareness, they tend to look negatively on themselves and become anxious about speaking. So things that are already anxiety inducing to everyone, like speaking to your boss, public speaking, that's already going to make people more likely to be disfluent, even if you don't have a fluency disorder. But for somebody who has a fluency disorder, they also have this added layer of, I don't speak like everyone else, and that's a bad thing. And so I want to make sure that we all know that it's not a bad thing to stutter, and that a person who stutters doesn't necessarily have anxiety in the clinical sense, and there's not necessarily something about their life that is making them anxious, but we can use relaxation techniques to kind of quell that anxiety about speaking, if that makes sense. Please share with me if that did not make sense. I feel like I kind of got lost in that sentence. Okay, so if you have a live session with me, you'll see me do this positive reinforcement of smooth speech. And I want you to do this positive reinforcement in your practice. So, as we kind of go along through the program, I'll talk more about different types of reinforcement, reinforcing the strategies, doing corrective feedback. But for right now, I want everybody to just be practicing positive reinforcement, because it's thought that for every one corrective feedback statement, you need 5 positive statements. So I want everybody to get used to giving your child positive statements about their speech. So, for example, if you are at the breakfast table and you ask them what kind of cereal they want, and they say, I want Captain Crunch, and there was no fluency problem with that statement, great. Tell them something like, I like your smooth speech. That was really smooth. I like your speech there, something that's positive that kind of starts to let them know what we're looking for. So no corrective feedback yet. I just want everybody to be positive. And we'll talk about that a little bit later, and we'll add those different feedback techniques. All right. And then let's see, the last thing. So I've talked a little bit about what you can expect in my videos and a tiny bit about what your homework is going to be. So for everyone, I'm touching base with you about once a week. So for our live sessions, I might get to talk to you a little bit before or after we do our direct speech therapy practice. For those of you that I'm doing phone check-ins, this is going to be pretty much all of your time here. So a rating scale. What do I mean by that? So this can be something that's really, really easy. So what I suggest is having like a notepad somewhere, like on your nightstand, and just write the date and write a number 1 through 10. So my rating scale here is from 1 to 10, right? 1 meaning that you saw no fluency issues, everything was great. And 10 being the worst stuttering you can possibly imagine. Every single sentence had stuttering. It was difficult to get out. It was difficult to listen to. And I mean, not emotionally difficult. I mean, like, I don't understand what they just said because they just stuttered so much. And then like a 5 might be, you definitely noticed there was some struggle, but it might be on like half of what your student said or a little bit less than half. So rate your student's speech. We're not looking for a comparison of what your student usually does. So for example, let's say we're talking about Johnny, and Johnny has like a normal average for him day and you rate him 5. And then the next day, like, oh my gosh, I've never heard him stutter that much. I'm going to give him a 10. That's very subjective. I want you to look at your student's speech very objectively for this rating, right? So 10 is the absolute most anybody can stutter ever. So 10 isn't necessarily the worst you've ever seen your child stutter. It's the worst stuttering that can possibly happen. So I'm not expecting to see very many 10s ever, right? So let's see. Yep, that rating scale every day. So it just takes about 15 seconds, and then have that information ready. Was this a really bad week? Was this a really good week? And also to kind of remind everyone, stuttering is cyclical. So there will be weeks that are worse. And that doesn't mean that the speech therapy isn't working or that your student isn't working hard. It's just we have our high stuttering days and our low stuttering days for sure. All right. And let's see, let's finish up here. So during your check-in, you can also ask any questions that you have about strategies. So if something wasn't particularly clear or you're confused about how to implement something, go ahead and ask those questions, absolutely. And then share what worked well. All right, are our strategies working well? Definitely share that with me so I can continue to, cater to the specific student. Not everything works well for every student. What didn't work well? And furthermore, when you were practicing the speech strategies or giving your reinforcement and your feedback, what was the child's reaction? Maybe it's, I'm trying to practice our turtle speech. And every time I try and practice speech with Johnny, his little sister comes up and interrupts us. Okay, let's brainstorm. How can we make it work within your family? Yep. So that's it. That is what you can expect from this program. Go ahead and ask me any questions. Feel free to contact me on the channel or by phone or by text, by email. You guys know all the stuff. And let me know how you guys are feeling about this distance learning fluency plan. I will see you next time. Bye. I can't stop recording.